Hi, this is Dr. Ramdip Ray. I'm the liver transplant surgeon here at Artemis Hospital in Gurgaon in Delhi NCR in India. Today we'll be talking about living donor liver transplantation or LDLT. So liver transplantation can be of two kinds, very broadly speaking. When you get a liver from a person who is brain dead, so it's a liver from a person who is actually dead, and the entire liver is taken and transplanted onto the patient or the recipient. So that would be a deceased donor liver transplantation or a dead donor liver transplantation. In Asian countries, in India, in northern India especially, living donor liver transplantation is the more common form of transplantation, LDLT. It is also referred to as LRLT or living related liver transplantation. Why living related? Because usually it would be a relative of the patient who would be donating a part of the liver, typically the right lobe, when you're looking at an adult to adult liver transplantation. So in that case, you see that what happens is that the right lobe of the relative is taken and then it is transplanted onto the recipient. So it's LRLT or LDLT. So in case of liver transplantation, the entire diseased liver or the entire cirrhotic liver, so the liver is damaged because of cirrhosis and that liver needs to be taken out. In that sense, it is different from a kidney transplantation. In kidney transplantation, typically the diseased kidneys are not taken out. The two kidneys remain, but an additional kidney is placed inside the patient at a different place within the tummy, within the abdomen. In case of living donor liver transplantation, or in case of liver transplantation in general, the diseased liver or the cirrhotic liver is first taken out from the patient. Once that is done, you either place a half liver or a whole liver into the same place in the recipient or the patient. When we are considering LDLT or living donor liver transplantation, in that case, half of the liver is taken from the donor. So in the donor, so let's get back to let's first discuss a little bit of anatomy. So generally you would think that a person has one liver. Well, it is true in a sense that there is only one liver, but actually we say it's 8 small livers. It's just that they have been packaged as one. So if you see the numberings here, 1, 2, 3, 4, 5, 6, 7, 8. So up to 8. So there are 8 different segments of the liver. And they have been sort of packaged into one. But when we do a CT scan with some software reconstruction, we can see all the different arteries, veins, ducts which supply all these segments separately. So surgically speaking, we now have 8 livers which have been packaged as one, which makes it possible for us to go in between the different segments of the liver, and then we may decide to give a part of the liver. So if you look at this schematic here, you see that this is the left side, which includes segment 2, 3, 4A, 4B, and this here is the right side, which includes segment 5, 6, 7, 8. So if you're looking at an adult to adult liver transplantation, then the right side of the liver, the entire right side, is transplanted onto the patient. And that is called a right lobe living donor liver transplantation. So if you look at this picture here, you see that the diseased liver has been already taken out, and here is the donor, and that's the right side of the liver. This right side is taken and then placed onto the patient. So this is a right lobe living donor liver transplant. So what happens to these half livers? Now the liver is a unique organ. It has a remarkable capacity to regenerate. So what happens is that the remaining left lobe in the donor grows back, and it grows back quite rapidly. So if you take out the entire right side, and the remaining 30, 40 or 45% of the liver will grow back very rapidly within a few weeks to almost 80% size, and within a few months to near normal size. So although it's only one liver, when you donate half, it grows back. And even in the patient, the liver grows back. So depending on the size of the patient, the body weight of the patient, the liver will grow to the required size. In case of babies, you don't need to give the right side, you may be giving a small part of the left lobe. In case of bigger children, we might be taking the entire left lobe and donating. And again, the liver will grow. And sometimes, in fact, the liver can even shrink. So if I were to donate a part of the left lobe to a small baby, then that small part of the left lobe may be too big for the baby. In that case, the liver will not grow, but in fact will shrink a little bit to be appropriate to the size required for the baby. So such is the remarkable ability of the liver. Now, who can be a donor? So the donor has to be a relative, either a first degree or a second degree relative of the patient, which is why the laws, what they say is that the donation has to be altruistic. It has to be out of love and affection. And so that's why the government of India, the government of different states have different measures in place. They have specific bodies, committees who examine all the documents, who examine the proof of relationship, and then they look at the HLA or DNA test which proves the claimed relationship, and only then the government gives the permission for the donor to go ahead with this transplantation. So the donor then donates a part to the relative. Very often we say that this is a disease, liver cirrhosis is a disease in which we the doctors cannot cure the patient. It is the donor who has the cure for the patient. The donor is donating a part of his liver to his near and dear one, to his relative. He is the one curing. We are just implanting the organ. We are just putting the organ and helping the donor save the life of his relative. So this is the general thing about living donor liver transplantation. The donor has to be a relative and usually would have to have a matching or a compatible blood group with the patient. Usually the donor would be between 18 to 45 years of age. People have done up to a little more than that, but once you cross 40, the test, you come up with something or the other that's wrong in the test. But generally 18 to 45 age group is a safe age group to go ahead with liver transplantation. You cannot be a donor unless you are 18 or above. And you need to be free of disease, you need to be fit, you need to be healthy, and you need to have a healthy liver, not a fatty liver. You can't be too much overweight, you can't be actively drinking. So once all these things have been excluded, a number of tests are done, and then the person can donate a part of the liver. A living donor liver transplant is probably one of the most complicated operations on the human body as of today. Not just in terms of surgical complexity, but also in terms of the emotional implications where you're donating a part of a very vital organ to your relative. But the results across the world are quite gratifying. It's a relatively safe operation. Worldwide, the risk has been estimated at around 0.5% or 1 in 200. But the idea is that all the tests, all the pre-op tests have to be, almost normal, and only then a donor is taken up for living donor liver transplantation. The results of living donor transplantation have been quite gratifying in our hospital and in all busy centers across the world. They are all above 90% success rates, and living donor liver transplantation in India is one of the most successful programs across the world. So India has become a global destination for liver transplantation. If you have any further queries, do feel free to contact us or our transplant coordinators at Artemis Hospitals.